She's helping us out with little embarrassing beauty issues that are actually fixable, and we're fixing them right here on the spot. We did skin tags, we dealt with adult acne. This is Cara, and what are we going to be doing for Cara?
Well, we're going to take a peek at her earlobes. So people are wearing, fashion causes us to wear big, heavy earrings. It kind of goes back and forth from the big earrings to the smaller earrings. And that's stretching out our earlobes. And some people are actually using gauge earrings. And that's a term for young people.
Yep.
Yeah, that stretch out their earlobes to massive proportions. So I'm seeing more and more people coming in with issues with their earlobes. And that's what we're going to treat for Cara today.
So, Cara, do you love big earrings?
I do. I do. Yep, big, heavy hoop earrings. And it all really started when I was a kid. I had them pierced with a needle and thread from a neighbor.
Oh.
Yeah, so from there, I just kind of progressively got more and more stretched.
So you're a little self-conscious about your earlobe?
Quite a bit, actually, yeah.
What is it that it's bothering you? Is it what,
well,
that the hole itself is too big, or that there's
that
too
it
much?
stretches.
That the lobe stretches if you put earrings in.
Yeah, well, I kind of wanted them to stretch at one point because they're kind of big and flippy, but
While you
it's
talk, I'm gonna
tearing.
get this ready.
Sorry, I'll stop.
So how do you fix this?
So earlobe repair cannot be done just with putting a stitch into it. That's a lot of people think, oh, well, you just have to put a stitch in it and it'll close up. You actually have to cut the entire hole out and stitch it back together, raw surface to raw surface. And that's what we're going to do here in just a second.
Yeah, thank you.
All right, here we go.
And then afterwards, you can re-pierce it. So I typically recommend waiting about 6 to 8 weeks, and then you can re-pierce it at that point.
Can you go 6 to 8 weeks without hoop earrings?
No.
You're going to have to.
I'll keep my hair down.
Wear your hair down, exactly.
Yes.
You are going to do this for her later on the other side, right? So she's
her other side was pretty good.
Yeah, I was going to say, this side looks fine.
Yeah, her other side's pretty good. So really, all we have to do is cut this side out.
Okay.
It takes just here a couple of minutes.
So it must be happening, huh?
Yeah, do you feel anything?
No, but her face looks like it feels something.
Sorry.
If you feel something, just squeeze her hand really tightly, and it'll be fine.
Okay.
Okay.
All right,
Hold on to me.
So the idea basically is just to cut the old piercing completely out. And then we'll stitch it back together. I got a fancy little instrument here that allows me to see the piercing really easily. You got to take it out completely all the way through and through, otherwise it becomes a problem.
It's unbelievable. So you're really just removing a canal, basically.
Exactly. Yep. It's basically exactly what you said.
It looks like a little tube.
Yep.
I thought I might be having the whole earlobe taken off. But
No.
Yeah, I didn't know.
No, he's just taking out the hole itself.
Yep.
Whoops, sorry.
And that's the other side right here.
Look at that.
And just a couple of stitches will be all good.
It's very cool. Yeah, he literally just pulled the pierce hole out, and he's just going to sew it back up.
Yep.
It's amazing. Now, what happens if it's
That is
really
not bad at all. Honestly, it's not that creepy. So then you'll just pull the little stitch back out, and then you can just re-pierce it once it heals.
So, yeah, you want to give it about 6 to 8 weeks, and the most important thing is when you re-pierce it, don't re-pierce it in that little scar, because then it's going to tear again. And God forbid you don't want that again. So you give it a good 6 to 8 weeks, it should heal just fine.
So should she consider, Dr. Youn, maybe stitching up the other side, even though it's not that bad,
I don't think so.
She can re-pierce in even spot?
Well, sometimes people will come in and they'll have piercings that are in multiple areas, and I tell you, in those situations, yeah, sometimes we'll close both of them, but in this situation, it's really not that big of a deal.
Looks great. You numbed her already, right?
Yes, so I pre-numbed her in the green room in the back.
Now, will she have a lot of discomfort when that wears off?
No, this is going to be it's real easy for this to be tolerated. Just a couple of stitches here, and then once again, you give it 6 to 8 weeks. She may have a little bit of a bruise, and that's about it.
That's great.
And she can go ahead and go back to wearing those hoop earrings again.
For now, you're going to rock the pirate look. You got the one. You got the Jack Sparrow.
All right. I'm okay with that.
Here we go.
All right.
Good job. Way to hang in there.
Thank you very much.
Okay.
Good.
We have time to quickly get to one more of our viewers. A very common problem here. Nicole again, another Nicole, right? Nicole, you say that you have a problem with bad breath.
I do. It's just, I get dry mouth, and it's been something since
Dry
I was
mouth.
a teenager.
Yep, a lot of people have this.
Yeah, so
Let me get on the other side.
50 million Americans suffer from bad breath. And people erroneously think that it's due to not brushing your teeth or due to cavities or gum disease. Reality,
It
actually,
isn't.
it is not. It's actually due to bacteria that grow way in the back of our tongue. and it's called anaerobic bacteria. And these bacteria produce what we call volatile sulfur odors. These bacteria are actually very similar to the bacteria we have in our intestines, believe it or not.
Wow.
And as we know, that
And we
bacteria,
all have them.
and that bacteria produces odor too.
Right.
So people get this bacteria in the back. We don't all have it. Only certain people who
don't all
have
have it.
actual halitosis have it. It creates this terrible odor, and people find that it really affects every part of their daily life. There are treatments now to treat this bacteria, okay? Because the best way to treat then this halitosis is not just to brush your teeth more, but to actually scrape up and get rid of the bacteria in our mouth. And so we're going to have her use the ProFresh system, and that's all of this stuff right here.
So you have to scrape the back of your mouth? That's where it lives?
The back of your tongue.
The back of your tongue.
Yeah, it has two main factors. Number one, you actually do a tongue scraping. So you
Right.
take a device like this, you grab your tongue, you stick it out as far as you can and scrape the back to get rid of those bacteria that are producing that foul odor.
Gotcha.
And you can also use a mouth rinse that we have in these cups called chlorine dioxide. Chlorine dioxide actually will destroy the bacteria as well as get rid of that foul sulfur smell.
So you have to do both, or could you just do the rinse?
You have to do both.
Gotcha.
Now, the chlorine dioxide, very powerful. We actually use it in waste treatment plants.
Oh my gosh.
So if it's strong enough for a waste treatment plant, it should be strong enough for bad breath.
And how often a day would she have to do that? Once every morning? Is that enough? Or
It's twice a day.
twice
so you
a
want
day?
to
So
start.
when you brush your teeth, basically.
Exactly. So you want to start. We're going to have her do it here in a second, but you want to do that. Then afterwards, brush your teeth, floss your teeth. Brush your tongue, brush the other parts of the inside of your mouth as well. And that's how you can really get rid of bad breath. 99% effective,
Wow.
ProFresh, in getting rid of bad breath.
And reasonable? Are these treatments reasonable?
You can buy it
chemical
online,
that you
$40
get?
to $50. Yeah,
And
then
how
you just
long would
use
that
your own
last her?
toothpaste. That should last a few months.
That's
Yeah.
great.
And people are finding that they can see a result very, very quickly.
That's great.
Okay? So now the halimeter here, it's going to give us a number of just how bad her breath is. If the number is higher than about 40 or 50, it means she has bad breath. Now, I got up at 5 a.m., I brushed my teeth this morning, but I haven't brushed it since then. I tested on myself, and I tested 40.
Right.
So we'll see where she is. And I don't think I have bad breath, but...
I just had a cup of strong coffee. I'd blow the thing up.
All right, here we go. So go ahead and put it in your mouth. And we're going to watch this number go up right here. So we're at 14, 19, 28, 40, 54, 72, 90, 109, 125, 139, 156. I've never seen a score this high. She's right around 150.
156, yeah. She's
Yeah,
sort
so
of hovering.
anything over about 40 or 50 is considered bad breath. So she's got that issue
So
that we're
she's got
seeing.
the issue.
She ends at 174.
You were born special with them little critters. That's all. That's all. You just got little critters. So
let's
show
get
her
rid of
how
it
to
for
use
her.
this quickly.
Okay, so you want to rinse with this for 10 seconds. So go ahead and just put it in your mouth. And you want to just, don't drink it, just kind of rinse it around. And we'll go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then you want to lean your head back, stick your tongue out, and gargle with it.
Oh, dear.
And you're supposed to do it for 10 seconds, but for time's sake, let's go ahead and have you spit it out.
Okay.
There you go. And here's a tongue scraper.
Okay.
And now you want to scrape the back of your tongue as far as you can get without gagging yourself. Stick your tongue out, and you want to scrape it 6 times back to front, and then go ahead and rinse it. And we'll just have you do one more time for the sake of time here. There you go.
But you know
So
what?
you're getting back, and you can see
It'll
what we're
get
getting.
easier the longer.
This is all that bacteria that we're getting in here.
The more you do this, the easier it'll get. And at
then
least
one
there's
more.
a solution, right?
Exactly.
And then one more quick
I've
rinse
tried
here.
everything.
So this'll help.
Mouthwash products, toothpaste. I have to constantly chew gum and eat mints just to have that fresh breath.
This'll fix it. Yay, we fixed it. Thanks again to our wonderful, brave viewers, to the great Dr. Youn. Up next, I'll meet you guys in the kitchen.
Rinse one more time.